Surface anatomy of the back involves identifying key bony, muscular, and vertebral landmarks essential for clinical examination and procedural accuracy. Midline structures include the posterior median furrow, which is a visible vertical groove that traces the midline overlying the vertebral spinous processes. The C7 vertebra, also called vertebra prominens, is the most prominent bony protuberance at the base of the neck, easily palpated when the neck is flexed. Below it, T3 aligns with the scapular spine, while T7 corresponds to the inferior scapular angle when the arm is adducted. The iliac crests intersect the midline at L4/L5, a critical level for lumbar punctures. The sacral dimples, which mark the posterior superior iliac spines, indicate S2, denoting the dural sacs end. Lateral landmarks include the scapula's borders. Its superior angle lies at approximately T2, the spine at T3, and the inferior angle at T7. The trapezius muscle forms the upper back's contour, while the latissimus dorsi creates lateral folds. The erector spinae muscles flank the median furrow, appearing as longitudinal bulges. The iliac crest is palpable at the waistline, with L4 located at its highest point. Clinical triangles include the triangle of auscultation, bounded by the trapezius medially, latissimus dorsi inferiorly, and medial scapular border laterally. This space at the T6 intercostal level allows optimal breath sounds auscultation because muscles are thin here. The lumbar triangle, also called triangle of Petit, is formed by the latissimus dorsi posteriorly, external oblique anteriorly, and iliac crest inferiorly. It's a potential site for herniation and is palpable above the iliac crest. Dermatomes and nerve points include cutaneous innervation patterns. C6 through T1 overlie the upper scapula and shoulders. T4 through T12 dermatomes align horizontally, with T10 at the umbilicus level. The greater occipital nerve from C2 exits approximately 2 to 3 centimeters lateral to the external occipital protuberance and is often tender in neuralgias. Dynamic landmarks show that arm movement alters scapular position. Elevation reveals the spine of scapula more prominently, while adduction shifts the inferior angle medially. The inferior angle of scapula moves from T7 at rest to T8 through T9 during arm elevation. Mastering these landmarks aids in spinal level identification, nerve block targeting, and detecting asymmetries in muscle tone or spinal curvature. This video is part of our free back anatomy course, perfect for medical students. We're excited to share the full course with over 100 lessons. Find the link in the description.